Adam's apple. But for women, you can actually start from the up, like where the jaw meets the neck, and then you just move down and feel for the small notch there, thyroid cartilage, and then if you move down, there's a prominent slight bump on female. Okay. So Li15, Li18 is on the lateral side of the mind, maybe sitting, turning the other way. Okay, so it's on the lateral side of the neck, level with the tip of the laryngeal prominence. It's between sternal and clavicular heads of SCM muscle. So, can you turn your neck? And can you read this my hand? Like the other way. So you could see here, this is the sternal head, clavicular head, goes up all the way to the mastoid process. This is the SCM muscle. So what you do is, for Li18, it's in between sternal and clavicular head. So what you do is, once you locate sternal head, you trace up to the level with the laryngeal prominence, and the point should be.
And should his head chin be down, or should he have it set?
Usually in the resting position. So whenever you locate points, the neck has, or the body part has to be in resting position. So in this position, you could still trace it up, and then that should be Li18. Right. If I show you, can you read this my hand the other way? Yeah, so you could actually see it goes in between. Yeah. Okay. So that's Li18. Any questions about this one? No?
Straight back, or does it look kind of angled?
So are you worried about any veins or arteries with this point?
So we have internal jugular vein underneath the SCM muscle. So although it says perpendicular insertion is not common because you could possibly puncture the internal jugular vein. So usually it's, for the neck point, it's safe to go more oblique or transverse insertion. So although the textbook says cautionary point for carotid artery flows anterior border. So Li18, if you go perpendicular or transverse or oblique, it shouldn't really puncture carotid artery unless you're pointing the needle anteriorly, right? So if you go this way, possibly you may puncture the carotid artery. But this direction, internal jugular vein.
Question for you.
Yeah.
Where it kind of looks like it's a little higher, are you kind of landmarking where they blend into one in relation to the Adam's apple, or are you kind of going straight back?
You're not really straight in going this way.
So more
Usually what you do is, once you find the Adam's apple and find the depression, you can actually palpate along the line and feel for the depression. So it could be actually a little more this way. Okay, so next one, okay, the description you can check your. Okay, next one is stomach 9. So stomach 9 is level with the tip of the laryngeal prominence. So it's the same as Li18. This one is on the anterior border of the SCM. Although in the textbook it talks about tube measurement, 1.5 to lateral to the laryngeal prominence, we don't usually use a tube measurement to locate this point. Rather, you just find the SCM muscle and go anterior border of the SCM muscle. So that should be anterior border of the SCM muscle. So that should be stomach 9. So stomach 9 is the one that could puncture carotid artery. Okay.
So is there a needling, or are you going to needle like inferiorly, superiorly, posteriorly, or are you going to do transverse?
Well, theoretically, you could actually go perpendicular, but for me, I usually, when I use it, I just use it more kind of oblique transverse insertion towards the SCM muscle. Because these points that can actually be used to release the SCM muscle. So in that case, you can actually just do needling along the muscle.
And when
L04.2,
Huh?
from from Futu to Renmin.
Yeah, depending on the patient's position, you could go this way or the other way. But usually it's safer to go the other way because if you point this way, you're pointing the needle toward the carotid artery, right? So next one is small sign 16. So this one is on the posterior border of the SCM, level with the laryngeal prominence. So this is the sternal head, clavicular head of SCM muscle. So if you move up, level with the laryngeal prominence, there is small sign 16. So 3 points, level with laryngeal prominence. Anterior border, we have stomach 9 in the middle, LI 18, posterior, small sign 16. Okay. And a few more, right? Okay. So next one is level with the angle of mandible. So angle of mandible is here, right? So small sign 17 is depression between angle of the mandible here and anterior border of the SCM muscle. So SCM muscle goes up all the way to mastoid process, right? To here. So if you go behind the angle of the mandible, but anterior to SCM muscle, we have small intestine 17. So this one also, you have to be careful not to puncture the carotid artery. The next one is Sanjiao 16. It's on the posterior border of the SCM, level with the angle of the mandible. So what you do is, from the angle of the mandible, you could place your finger this way, and then find the posterior border of the SCM muscle. That would be Sanjiao 16. Okay. So it says it's about 1 shin inferior to gallbladder 12. Gallbladder 12 is from the mastoid process. You're moving posteriorly and inferiorly to the mastoid process. That is gallbladder 12. So that's about 1 shin below gallbladder 12, Sanjiao 16. Right? Let's do maybe 2 more. So next one is at the base of the neck. So can you turn your, I think it'll do, okay. So the next one is RIN 22. It's on the midline of the body. It's in the center of the suprasternal fossa, 0.5 superior to suprasternal notch. So this is the sternum. The notch is here. You can actually feel a slight indentation there on top of the manubrium. So from suprasternal notch, you're going to place your finger at the notch, and you're going to move your finger up, and where your finger stops, that's the suprasternal fossa. So that should be RIN 22. If you put RIN 22, if you put needles too close to the notch, the needle will hit the bone before it actually go behind the sternum and move downward. So you have to go slightly above the notch and find the fossa. So this one has special needling insertion method. So usually what you do is you do the first tapping, that's about 0.3 chin, and then you just drag the needle up and insert the needle like behind the sternum. This one you have to be careful because sometimes you can actually see the pulsation at RIN 22, which means it's close to the artery. So you have to avoid puncturing the artery. If you point the needle sideways, it also carries the risk of pneumothorax. So also close to carotid artery, so you have to be careful. A very effective point for cough. So next one is stomach 11. It's at the root of the neck, superior to medial end of the clavicle. This is the clavicle. The medial end is here, and it's in the depression between sternal and clavicular heads of SCM. Sternal head, clavicular head, depression in between is here. So if you go to medial end of the clavicle and move up, that is small intestine 11. That's where the subclavian artery and vein travels. So you could possibly puncture subclavian arteries and vein. And also, lung and pleura extends about 2.5 centimeter above the medial third of the clavicle, which is about here. So this point could also cause pneumothorax. Okay, so locate these points on each other's body. It's in the depression above the hyoid bone. So Adam's apple, you move up, and you can feel the hyoid bone above. If you're not sure, you can also ask them to swallow.
What was that?
Then you can feel the movement of the hyoid bone. And once you feel it, you go right above. Feel the depression. That should be Rin 23. In this one, you're inserting the needle towards the root of the tongue. Okay.
Towards the tongue.
Yeah. And then Shang Lian Chuan. Shang means above. Lian Chuan is Rin 23. So if you go about halfway between the lower jaw and Lian Chuan, about halfway, then that's about one chin below
Mandible.
the midpoint of the lower jaw, or you could just go about halfway. That's Shang Lian Chuan. That's also towards the root of the tongue. Okay, so next one is next one is large intestine 17. So it's on the lateral side of the neck, one chin inferior to LI 18. So if you go one chin below LI 18, and you have to go posterior border of the SCM muscle. So what you do is from LI, once you locate Adam's apple, move to the depression between sternal and clavicular fiber of the SCM muscle. And you're gonna move one chin down and move posterior to SCM muscle. So that should be small intestine 17. Okay. So for cautionary point, although it listed carotid artery, because it's located posterior border of the SCM, it's less likely to puncture carotid artery unless you're inserting needle towards the anterior side deep, right? So more likely, maybe if you puncture, you will puncture internal jugular vein in case you're pointing needle anteriorly. Stomach 10 is on the neck, anterior border of the SCM. It's halfway between stomach 9 and stomach 11. So if you go about halfway, anterior border of the SCM, it should be about here, stomach 10. So when you do needling in the resting position, maybe you could go about here. On the anterior border of the SCM, halfway between 9 and 11. Okay, so next one is the back of the neck. Can you turn around? So in the back of the neck, mid is behind the ear, midway between gallbladder 20 and Sanjiao 17. I think these points we're going to cover later on. But Sanjiao 17, what you do is it's behind the earlobe. So when you remove the earlobe, we have mastoid process, ramus of the mandible. If you go depression in between, that should be Sanjiao 17. Sanjiao 17 is above the transverse process of first cervical vertebra. So if you move down, you can feel the hard bump here. That is the transverse process. You have to go above. So right behind the earlobe, we have Sanjiao 17. Gallbladder 20. I think we covered last time, right? So find the due 16. So from EOP, move down all the way until you feel first depression. That's due 16, mastoid process. How many, Chin? 4.5. If you divide into half, that's gallbladder 20. So from gallbladder 20 to Sanjiao 17, you're gonna divide it into half. Then it should be about here. That should be Mian. So people who have poor sleep, you can actually massage from Mian all the way down. Then that can actually help with the sleep. Okay. And last point is Bai Lao. It's at the back of the neck. It's 2 chin superior to do 14, 1 chin lateral to the midline. So do 14 is below the spinous process of the C7. And then posterior line. So from do 14 to posterior line is 3 chin. If you divide that into third, you can find 2 chin above the do 14. So you move 2 chin up and 1 chin lateral, right? That should be by Lao. Okay, so locate these points. So inner canthus is here, the corner. So you're just moving 0.1 chin medial and superior. So right here will be bladder 1. Okay. I'll put stickers there. Okay, so this point, when you're doing needling, you can do really slow. Just go perpendicular and close your eyes. And you just want to go kind of, the needle has to be kind of curved around the eyeball. And yeah.
Indication for that point again?
Huh?
What would be, when would we use this point? Like what are some of the indications for bladder 1?
For eye.
Just anything eye pain?
Yeah, eye disorder or vision. Yeah,
Okay.
good point. Stomach 1, when eye is looking directly forward, the point is directly below the pupil. So if you go directly below the pupil, it should be right here. So it's between the eyeball and infraorbital ridge. So this is the infraorbital ridge. So you go right above the bone and between the eyeball and the infraorbital ridge. Okay, kind of hard to put stickers on. And stomach 2 is eyes looking directly forward, 1 chin below the pupil. But you don't worry about the chin measurement, but you have to find the infraorbital foramen. So one of the tricks is from the corner of the eyes, when you follow the line, go down, then you can actually feel the depression right here. When you press onto that point, is it tender?
Mm-hmm.
Yeah, that's infraorbital foramen. So that should be stomach 2. Okay.
Stomach 2.
Next one is Choho. Choho. So this is along the inferior border of the orbit at the junction of lateral quarter and medial 3/4 of infraorbital margin. So what you do is the stomach points, like stomach 1, is halfway. And if you divide that into half between stomach 1 and lateral canthus of the eye, that's the junction of lateral quarter and medial 3/4, right? So that should be Choho. And then gallbladder 1 is in the hollow on the lateral side of the orbital margin. It's about 0.5 chin lateral to outer canthus. So from outer canthus, you just move 0.5 chin and feel that orbital margin and feel the depression right lateral to the orbital margin. That should be gallbladder 1. Next one is Shang Ming. Shang is above, Ming brightness, and that usually relate to the eye in Chinese medicine. So it's directly above the pupil, below the margin of the orbit, or below the supraorbital ridge. So you're gonna go, close your eyes. So So you're gonna go right between the eyeball and supraorbital ridge. Okay, so it should be right.
Is it kind of like a tissue, or you want to be kind of on that ridge on the bone itself?
Same, it's below the bone,
So
but above the eyeball. So same, you're just inserting the needle, and it has to be just going like
curving it.
curving
Around.
the eyeball. Yeah.
So for this point, do we ask the patient to keep the eyes closed all the time?
Usually, yeah.
So they can open
It's like open the eyes. I'm gonna insert some needles.
Yeah, I don't know. I don't use this point, so but
Dangerous.
yeah. But usually around the eyeball, patient may not be comfortable with you needling either. So, and then in tongue, between the two medial end of the eyebrow, that's very commonly used point. And bladder 2, superior to inner canthus. So if you go right above the inner canthus, there's a depression on the eyebrow close to its medial end. So when you go to medial end, you can actually feel the tiny hole there. That should be bladder 2. And Yuyao is center of the eyebrow. If you go to the center, again you can feel slight depression there. That should be yeah. And Sanja 23, depression on the supraorbital margin. This is the supraorbital margin and lateral end of the eyebrow. So that should be Sanjiao 23. Taiyang point is at the temple. Depression. So what you do is find the Sanjiao 23 or lateral end of the eyebrow, outer canthus. Go halfway, and you're gonna move about 1 chin posterior, and feel for the depression in the temple. That should be Taiyang point. Good. Okay.
Wait, can you say how you got there?
Oh, so find it. There, dude. And stomach 3. When eye is looking directly forward, it's directly below the pupil. Level with the lower border of the Alanazi. Alanazi is here. So if you go to the side, directly below the pupil, should be there. So go down the pupil and level with the lower border of the Alanazi. And next one is large 20. So Li20 is on the nasolabial groove. So can you smile? So that's nasolabial groove. And it's level with the midpoint of the lateral border of the Alanazi. So midpoint should be about here. So if you put it on the nasolabial groove, it'll be about there. Li20. And next one is E-tone. E-tone is the highest point of the nasolabial groove. So if you go follow the nasolabial groove all the way up, that should be E-tone. So usually for nose, we just insert the needle from Li20 towards B-tone. Then you can stimulate both points with one needle. Next one is Nei Ing Shang. Nei means inside. Ing Shang is large, it's saying 20. So it's actually inside of the nostril. This one just prick to bleed. So you may use a thick needle and insert the needle and then just prick to bleed. But I don't think that's commonly used.
Can I stop my nose?
And Li19, below the lateral margin of the nostril, it's level with D26. D26 is on the philtrum. If you divide the philtrum into third, it's junction of upper 1/3 and lower 2/3, right? So that should be D26. And if you move lateral to do 26. Directly below the lateral margin of the nostril. That should be Li19. Good? Okay. Shall we do a few more points?
Sure.
And stomach 4 is point 4 chin lateral to corner of the mouth. We don't really measure point 4 chin, but can you smile? When you smile, you can actually see that groove there. That's about point 4 chin. So you can see you're gonna just put it right there. Okay? So that's stomach 4. Do 27. It's on the midline, junction of the margin of the upper lip and philtrum. This is a philtrum, upper lip. So you go right there.
Oh wow.
That
On the
should
left
be
hand.
do 27. Rib 24 is above the chin. Depression in the center of the mental labial groove. Mental labial groove is here. So if you put it in the center, that should be rib 24.
I'm growing a beard and a mustache at the same time.
I'll do
Dream
one more.
coming true.
Jia Chengjiang. Jia means adjacent. Chengjiang is ring 24. So you're just moving one chin lateral to ring 24. If you move just directly lateral to one chin, you're actually feeling the teeth. So you have to actually move down, slightly down, and feel for the hole. And then you could put it there.
Do the point that was tender that you first touched?
Yeah.
Yeah.
Why do we have these holes?
So it's,
Nerves
that's-
on there.
Nerves.
Nerves, oh, okay.
Don't go there.
so it's slightly below ring 24 and one chin lateral.
What's that one called?
Jia Chengjiang. Chengjiang is ring 24. Jia means adjacent, so it's
Oh,
next
perfect,
to
thank
ring 24.
What was under B tone?
Is under.
When she lifts her upper lip up, you can see that the tissue that connects the upper lip to the gum, that's the frenulum. So you're gonna insert the needle at the junction of upper lip and the gum where the frenulum is located. It's just mainly prick to bleed. So in case someone have swelling of the gums, you could use just prick to bleed at that point. Next one is on the tongue. So can you stick your tongue out? So when you stick your tongue out, in the center is the Juchuan, center of the tongue. So you just prick to bleed and lift your tongue up. And you see the two veins on the side. So that's Jinjin and Yuye. So also prick to bleed. And if you go in the center where the frenulum is, that is the Haichuan. So all tongue points, all just prick to bleed. But usually tongue points are painful.
Have you tried before?
On my tongue, no. But usually patients do, find it very painful. Okay, so next one is stomach 5. So it's on, maybe let's do it this way. So stomach 5 is directly anterior to the angle of the jaw. So angle of jaw is here, angle of the mandible. So if you move directly anterior, you're just moving anteriorly. And this point is in the depression anterior border of the masseter muscle. So when you move anterior to angle of the jaw, you can feel this masseter muscle. If you're not sure, you can ask your model to clench their teeth. Then you can feel that contraction of masseter muscle. Go anterior border. So that should be stomach 5. Okay. That should be stomach 5. So this point is close to facial artery. So when you do needling, make sure you're not puncturing the facial artery. And stomach 6 is from the angle of the mandible. You're gonna move one finger breath up and anterior. So when you do that, it's on top of the masseter muscle, and usually when the person clench, that's a part that bulge out. Okay. So from the angle, move one finger breath up, one finger breath anterior. And when it says one finger breath, it refers the width of the proximal interphalangeal joint of the middle finger. Okay.
That's stomach 6?
Yeah. Stomach 7, it's at the lower border of the zygomatic arch and anterior to condyloid process of the mandible. So zygomatic arch connects the zygomatic bone to temporal bone, which is here. So it has a small arch there. So if you go anterior to ear, you could feel the arch here. So what you do is if you move your finger up, you can actually feel that arch. It's also in the depression anterior to condyloid process of the mandible. So if you want to feel condyloid process of the mandible, you can ask her to open her mouth, open and close. Then you can feel that movement of the condyloid process, right? So it's right anterior to that condyloid process of the mandible, in the depression right below the zygomatic arch. So that's stomach 7. Gallbladder 3 is anterior to the ear, and it's in the hollow above the upper border of the zygomatic arch. So from stomach 7, you're gonna go over the zygomatic arch, go right above, feel slight depression. If you compare the depression between GB3 and stomach 7, you will feel more depression compared to GB3. So when you compare the depths of needling, this one can go 0.5 to 1 versus 0.3 to 0.5. Okay. So next one is small intestine 18. This one is directly below the outer canthus. So there's the outer canthus. If you go directly below, feel the depression under the zygomatic bone. That should be small intestine 18. Okay. And the next one is Tianjin point. So this one is 0.5 to 1 chin anterior to auricular lobe. So from the earlobe, you're just gonna go about 0.5 to 1. So what you do is you're gonna palpate and feel for the tender point. Is this tender? Mm-hmm. So you find the tender point because you want to find where the facial nerve passes. So this point good at treating facial paralysis, and you just want to stimulate facial nerve with this one. Okay, and then okay, you guys can look here. So let's turn a little bit. Okay, so these points are 3 points anterior to the ear. The first one is gallbladder 2. It says in the hollow between intertragic notch posteriorly and condyloid process of the mandible anteriorly. So intertragic notch here, condyloid process of mandible is here. So if you find depression between two, the point should be right here, level with the intertragic notch, the posterior to the condyloid process of the mandible. So when she opens her mouth, we can feel slight depression like there, okay? Next one is, let's do Sanjiao 21 first. So Sanjiao 21 is depression anterior to supratragic notch and slightly superior to condyloid process of the mandible. Supratragic notch, supra means above, tragic refers to tragus, notch is here. So if you go anterior but posterior to condyloid process of the mandible, that should be Sanjiao 21. Small intestine 19 is in the depression between the middle of the tragus and condyloid process. Middle of the tragus is here. So if you go in between these 2 points, but behind the condyloid process of the mandible, that is small intestine 19. That's Sanja 21, small intestine 19, gallbladder 2. You should remember 21 equals 19 plus 2. If you can do math, that's how you can remember. So these are 3 points. These points close to what? Superficial temporal artery. So you have to be careful not to puncture the artery. Next one is Sandel 22. It's about 0.5 chin anterior to upper border of the root of the ear. Root of the ear is where ear attached to the head. So that's the root of the ear. Upper border of the root of the ear. So if you move 0.5 chin anterior to the root of the ear, you can actually see the hairline. So it's posterior to this hairline, but 0.5 chin anterior to the root of the ear. That's Sanjiao 22. So it's on the posterior hairline of the temple. This one also close to superficial temporal artery. So all those 4 points are cautionary point for superficial temporal artery. And the next one is apex of the ear. When you fold the ear in half, the highest point of the ear is the apex of the ear. It's a very useful point or commonly used point. So
For what?
for like reducing fever, relieve inflammation, lower blood pressure,
Ringing in the ears?
treating the eyes.
Ringing in the ears or?
Tinnitus?
Ringing in the ear, we use these point more commonly than this one. Yeah. Okay, and then we will do posterior side of the ear next time, but we'll do temp. Okay, we'll do one more point, forehead. Gallbladder 14 on the forehead. It's 1 chin superior to middle of the eyebrow. What point do we have in the middle of the eyebrow? Yeah. Forehead, 3 chin. Divide that into third, and that should be gallbladder 14. Okay. Temple point, we'll do it next time. Just do these 5 points, and that's all for today.